Hello and welcome to Talking Africa, the podcast that gets behind the news from the continent, brought to you by the Africa Report magazine. My name is Nick Norbrook, wishing you and your loved ones health and safety in these difficult times. I'm speaking to you from a locked down France. Joining me on the pod today is our South Africa correspondent, Kolisa Philip, from a locked down Johannesburg. Our editorial assistant in Nigeria, Tofe Ayeni, speaking to us from a locked-down Lagos. In a moment, our Kenya correspondent, Maurice Kiruga, from a locked-down Nairobi. Also with me in France, but not in the same building. Got to respect the rules. I have our new web editor, Anne-Marie Bisada, and our editor-in-chief, Patrick Smith. And as you may have guessed, it's a coronavirus lockdown special today. We'll be talking about how people are coping, about the impact of the virus on the economy, the potential of the spread into rural areas, the geopolitics of the virus as China pivots from victim into soft power mode, how to fight disinformation, the strengths and weaknesses of authoritarian states in moments like these, and much, much more. We'll be speaking all together in a moment, but I start one-on-one with Maurice in Nairobi. How have people in Nairobi taken to the prospect of being locked down?
Kenyans are a gallows humor kind of people. But at the same time, there is this sense of dread about... So the first death from coronavirus was announced yesterday in the evening. It's of a man who died at the Aga Khan hospital in Nairobi, and I think he'd just flown in from, I can't remember properly, but I think Spain. And so it's hitting hard that this is real. And at the same time, so for example, a spot check around where I live, which is about 13 kilometers from the city, but it's considered part of the city. Businesses have closed, even small sort of eateries. Guys are struggling. Yesterday in the evening, I was talking to a guy, who hawks water in Nairobi, and he was telling me now he can't sell everything. He can't sell anything because people are locking their windows. So the roads are clean, similar to other places. Mother Nature is refreshing herself with us. The roads are clean. Offices are closed. There's a sense of dread, I figure. There's a sense of dread for how much this has spread. And then, of course, also, so for example, a few days ago, I learned that one of the apartment buildings next to me, a Ministry of Health guys had done a visit because the neighbors had called the government to say that there was someone who just flown in from Germany. So you have a lot of, I guess, what you would call imprisoned snitching, but it's also social safety, as in there's a lot of, suddenly things are moving, but not at the speed that they need to move, given what we're seeing in Europe, for example. So we know this is bad. The entire country has 200 ICU beds. The government has been pulling back from public health care for the last decade. And it's not just been pulling back in sort of giving up the biggest hospitals or all that. It's also been giving up, with investing in medics and all that. So now they have to catch up really, really fast. There's also now, among doctors, there's a sense of dread that the way the government is responding to this and the entire focus on just coronavirus means that more people are going to die out of other preventable causes. Because, for example, an OBGYN I know really well was telling me that one of the biggest maternity hospitals in Nairobi, public one, is turning away patients. And I've heard this about multiple hospitals.
Right.
They're turning away patients with... other conditions. And so it's one of those things. It's an hour at a time, I guess. Yeah.
There had been this scandal with the private equity company that had invested in several hospitals in Kenya, and who was almost holding patients to ransom to try and get the most out of every single patient that they could. You've written on this. How How have the privately owned hospitals reacted in the face of coronavirus? Will they sort of see this as a business opportunity, or are they being told by the government that they have to really play the game?
I think at the moment, okay, so the updates on the story is there's still sort of the business has really gone down. Insurers, I believe, at the very end, almost including the national insurer, pulled out or all that. But then there's another scandal now about Nairobi Hospital, which is one of the oldest in Nairobi, oldest private hospital, I think, because during the colonial times it was known as the European Hospital. It's just changing management now this week because of I'm still waiting for the audit on that. But the test kits, because you can still get tested around, but it's really, really expensive. I think the ballpark figure I saw the other day was like about above $100, above 10,000 bob. There's been a sense of, I don't know, silence, dread on everyone's part. Because now most hospitals don't want to admit they're changing their own internal rules. So I don't think any of them are thinking about money now. And at the same time, you have a situation now where the healthcare system as was being saved by the fact that you could do a fundraiser to do a surgery in Kenya or in India. Now you can't fly to India. Now you can't do a fundraiser because everybody is pinching coins. So it's one of those things. I've heard from people that nationalizing the private healthcare system might be in the works, which I figure is when they're wargaming what happens when this gets worse. But I really don't think, I wouldn't be surprised if there's at least one or two thinking about profit now. But I don't think it is what it was when I wrote that story a few months ago. I feel like, first of all, doctors have gone back to, or rather medical staff, healthcare workers have gone back to basics, what they were trained for and all that. And the government is hiring more right now, although I haven't seen the progress on it. But yeah, there's a sense of dread on their part because the public healthcare system, especially in Nairobi, cannot handle the pressure that is inevitably going to come, which is more people. There are not enough ICU beds. They're not, public healthcare system has been neglected for a decade. So the government really doesn't have anything on its books to work with. So I figured they're also trying to negotiate some kind of a thing. But I still wouldn't be surprised if the Nairobians trying to make money out of this.
One of the things that happened in France and Italy was that when affected areas got locked down, so the region of Lombardy in northern Italy or Paris, a lot of people, Parisians and rich Italians in the north of Italy, they left as quickly as they could before the lockdown happened and went into the far-flung countryside of their country and brought with them, in some cases, the disease. Is that a risk in Kenya?
I don't think at this point we should even consider it a risk as more as a thing that might already have happened. Because first of all, Nairobi is sort of a tabula rasa. It didn't exist 120 years ago. So very few people actually have roots, like deep roots in Nairobi. So one of the things that happened is that when we started closing schools 2 weeks ago, of course, most people who have a choice, most rich people who have a Nairobi home and a home in what we call shags here in Sheng, just generally means a rural home, went home. So we don't know how bad it is. When you consider also the fact that devolution meant that we had elites who are based outside Nairobi. So, for example, the Kenyan coastal story of the Kilifi deputy governor was a guy who flew back into the country and then went to his office in Kilifi, which is really far from Nairobi. It's Mombasa should be about 550 kilometers. Kilifi should be further than that. And so he took it there and started a new cluster there. Right. Then we haven't been watching Malindi, which is known. Malindi is known as Little Italy because it's full of Italians. So we don't know how bad it is there. I haven't seen any confirmations yet of cases there, but Then you also have the fact that people went home. They went home to their parents. They went home to where they have farms. So I think if we were testing enough, it's really, really bad. Like, so far, we've tested 253 people, I think, by my last check. Confirmed about 31 cases. But yes, the fact that we didn't lock down the country, which would have been hard to do because Nairobi is home to mostly, say, millennials born there, millennials and after born there. But with older generations, you have people who have solid homes away from Nairobi. Another example being that my hometown is Kiambu, which is 16 kilometers from the city. When I was growing up, it was a rural area. Now it is legitimately part of Nairobi. So, yeah, it's one of those things. It's part of the city now. So, guys don't even have to be going home to their rural areas. They could just be going home because people live here and work in Nairobi.
Our thanks to Morris Kiruga in Nairobi. On to our general discussion now with Clarissa, Tofe, Anne-Marie and Patrick. And we start with sad news from South Africa.
We've woke up to the news that 2 people have died from coronavirus in South Africa. Those are the 2 deaths in the country. And they were both recorded in the Western Cape. Young people, 28 and 48, which is worrying for the government. In terms of Johannesburg, so to just clarify, the lockdown does not apply to essential service staff, retail being one of them, as well as hospitals and clinics. The police are out on the streets, the military's out on the streets, municipal cops are out on the street. And yesterday was a normal working day until midnight, so a lot of people didn't have time to go stock up on essentials. So they're out and about in the streets, but under very strict, conditions. So, for instance, if you go out and you buy your groceries, you're supposed to carry your ID card, identify yourself, say the reasons why you're out in the streets. And I think there's some sort of monitoring mechanism to make sure that people don't go in and out, for the sake of it, but they actually do go out to that they need. In terms of the markets, South Africa doesn't have, especially Joburg, doesn't have a big market culture. It's more Cape Town with Green Market Square that I would imagine is hard hit. In Johannesburg, we have a lot of informal trading downtown. So those people who run those stores are probably hardest hit because they have no money coming in, because obviously trading has stopped to observe the lockdown. And the other thing that I'd like to highlight for you is that SA now is on 1,000 confirmed cases of corona. So, the government is very cautious to ensure that we don't do an Italy, hence the lockdown under the very strict and onerous conditions that it's under.
And is it your sense that people are respecting those conditions in Johannesburg and then also in other parts of the country where perhaps central government may not have so strong a voice?
Well, funny you should say that, Nicholas. So this morning, there was a report on the local station, ENCA, that a bus carrying German tourists, about 14 or 15 German tourists, was out and about in the streets. And one of the tourists had tested positive,
Wow.
for COVID-19. And 2 of the Germans had exhibited symptoms for COVID-19. So we do have cases and instances where it's not necessarily South Africans, but it's locals visiting the country who aren't observing the protocols. There was also a reported case of another German tourist who tested positive in Mpumalanga at the Kruger National Park, decided to travel to KZN, to La Lucia, and he was tracked down, by government health workers. There's a system in place to track people who've tested positive, and he's been arrested and charged with attempted murder. So you do have, a sort of recklessness that's coming in, not necessarily from South Africans, but from outsiders.
And is there a sense that President Ramaphosa, who, in the months leading up to this, had been having a torrid time trying to enforce party unity let alone sort of push some kind of national vision.